Barbara Vega. I'm a student at Ivy Tech Community College, and my major is business administration. Today I will be giving speech number 3, the informative speech for COM 101, titled Sudden Infant Death Syndrome, Its Causes and Prevention. It is said that one of the greatest joys a person can experience is bringing life into this world, and one of the greatest tragedies is that of losing a child. According to the Center for Disease Control and Prevention's website, cdc.gov, walking into your child's room to find them laying lifeless in their crib is a horror that approximately 2,200 parents experience every year in the United States. The fear that your child may not wake up in their sleep has plagued parents since antiquity. Ancient writings mention such deaths. In the Book of Kings, one of the Hebrew books of the Bible, the child described as being overlaid by its mother was most likely a victim of sudden infant death syndrome. The purpose of my speech today is to inform my audience about sudden infant death syndrome, also known as crib death and abbreviated as SIDS. As a first-time mother of a 4-month-old, I would like to impart my knowledge about SIDS in order to help reduce the odds of this occurring to the child of anyone listening in my audience. Today, I will describe what SIDS is, what may cause SIDS, and what can be done to prevent it. So what is SIDS? The American Academy of Pediatrics describes SIDS in their 2005 policy statement as the sudden death of an infant less than 1 year of age, which remains a mystery after a thorough case, including a complete autopsy, a review and examination of the death scene, and review of clinical history. SIDS is the #1 leading cause of deaths among infants. 90% of all SIDS cases occur within the first 6 months of life and peaks between 2 and 4 months. You may wonder who is at risk. Although the reasons behind sudden infant death syndrome remain a mystery, there appears to be a higher occurrence among boys than in girls, and a higher rate of SIDS among Native American and African American infants. Premature babies and babies with a low birth weight are also at an increased risk of SIDS. Now that I have discussed what SIDS is, I will present to you the 3 leading theories as to what may cause SIDS according to Your Baby's First Year, Week by Week, written by Glade Curtis, a board-certified OBGYN, and Judith Schuler, a family studies expert. The first major theory behind what may cause SIDS suggests that when a baby is placed on their stomach to sleep, the rebreathing of exhaled air, which is low in oxygen and high in carbon monoxide, can contribute to SIDS. The second leading theory behind what may cause SIDS suggests that when a child is placed on their stomach to sleep, it sets off circulation changes, which makes it difficult for a baby's body to regulate the tone of their blood vessels. These circulation changes cause a decrease in blood pressure, and this drop in blood pressure may increase the resting heart rate, which is considered a significant factor in sudden infant death syndrome. The third major theory behind what can cause sudden infant death syndrome suggests that a baby who becomes overheated is at an increased risk of SIDS. The part of the brain that regulates body temperature can also affect the part of the brain that affects and regulates breathing. New studies show that abnormalities in serotonin levels can also affect the area of the brain that regulates temperature. Now that I have discussed what SIDS is and what may cause SIDS, I will present to you a few ways to reduce the risk of SIDS. The first way to reduce the risk of SIDS is to place a baby on their back when they go to sleep. The National Institute of Child Health and Human Development in 1994 initiated the Back to Sleep campaign. Citing studies that were conducted abroad, the Back to Sleep campaign advised that babies should be placed on their back in order to reduce the risk of SIDS. Since 1992 to 2000, the occurrence of SIDS has been reduced by 53%, largely due in part to the Back to Sleep campaign. The second way to reduce the risk of SIDS is to avoid co-sleeping with an infant and to make sure that the only thing in an infant's crib is the child and a fitted sheet. Bumpers, pillows, blankets, and stuffed animals all pose a potential threat of suffocation to a child. The third way to reduce the risk of SIDS is to use a pacifier during the first 6 months of nap time and bedtime. It's unclear as to why this reduced the risks of SIDS, but it is thought that perhaps the pacifier may keep breathing passages open and may help to protect against sleep apnea. Other ways to reduce SIDS can be to breastfeed a child, to place a fan in the room to circulate air, and to encourage tummy time, an activity where a child is placed on their stomach in order to strengthen their neck and back muscles. The purpose of my speech today was to inform my audience about SIDS in order to better educate them on the potential dangers that face our children. Today I have discussed what SIDS is, what may cause it, and what can be done to prevent it. It is my hope that you will go home today and share this information with friends, family, and loved ones, and together we can spread awareness and significantly reduce the infant mortality rate. Thank you.